Bismillahirrahmanirrahim. 14 important drugs. 1. Azithromycin. Overview. Azithromycin belongs to a macrolide antibiotic. Azithromycin is a 15-atom lactone macrolide ring compound. Azithromycin is a semi-synthetic derivative of erythromycin. Azithromycin is effective against gram-positive bacteria. Indications. Azithromycin is primarily indicated in conditions like cervicitis, respiratory tract infections, multiple myeloma, otitis media, reversal of excessive bradycardia, skin and soft tissue infections, urethritis. Contra-indications. Azithromycin is contraindicated in conditions like hypersensitivity, hepatic impairment. Side effects. Jaundice, cholestasis, rash, anaphylaxis, angioneurotic edema, vomiting, diarrhea, nausea, hearing loss, flatulence, dizziness, vertigo, headache, fatigue, palpitation, photosensitivity, deafness, GI disturbance. 2. Salbutamol, albuterol. Introduction. Salbutamol, albuterol is a beta receptor agonist. Salbutamol is a short-acting agent and is used only in the management of acute episode of asthma. It relaxes the smooth muscles in the lungs and dilates or expands the bronchi, airways in lungs and makes breathing easy. Indications. Uses. Albuterol is primarily indicated in conditions like asthma, bronchitis, bronchospasm, emphysema, exercise-induced bronchospasm, reversible airways, obstruction, and can also be given in adjunctive therapy as an alternative drug of choice in premature labor. Contraindications. Albuterol is contraindicated in conditions like cardiac arrhythmia, diabetes mellitus, hypertension, thyrotoxicosis, ischemic heart disease, hypersensitivity, antepartum, hemorrhage, toxemia of pregnancy. Side effects. The severe or irreversible adverse effects of albuterol, which give rise to further complications, include tachycardia, hypokalemia, sinus bradycardia, peripheral vasodilation, ventricular ectopics. Sign and symptoms after acute overdosage include flushing, nervousness, hypokalemia, palpitation, CNS stimulation, tremor, agitation, weakness. Symptomatic adverse effects include headache, nausea, vomiting, anxiety, palpitations, tremor, muscle cramps, heartburn, appetite stimulation. 3. Dexamethasone. Introduction. Dexamethasone is a corticosteroid. Apart from inflammation and swellings, it can be used in many conditions. Uses. Dexamethasone is used in swellings, inflammation, skin diseases, allergic conditions, breathing problems, cancer, blood disorders, eye diseases, and in arthritis. Dexamethasone is also used to treat nausea and vomiting produced by cancer chemotherapy. Contraindications. Dexamethasone is contraindicated in conditions like diabetes mellitus, hypertension, psychosis, osteoporosis, GI ulceration, infections, renal insufficiency. Side effects. Glaucoma, peptic ulceration, osteoporosis, edema, nausea, vomiting, skin fragility, nervousness, glucose intolerance, ocular hypertension, insomnia, nocturia, obesity, euphoria, and many more. 4. Prednisone and Prednisolone. Overview. Prednisone is the most commonly prescribed oral corticosteroid. The drug is metabolized in the liver to its active form, prednisolone. Prednisone is used in many conditions, including allograft rejection, asthma, systemic lupus erythematosus, and many other inflammatory states. Indications. Prednisolone and prednisone is primarily indicated in conditions like adrenal insufficiency, asthma, blood malignancies, connective tissue diseases, liver diseases, ocular diseases, renal diseases, respiratory disease, suppression of inflammatory and allergic disorders. Contraindication. Prednisolone and prednisone is contraindicated in conditions like diabetes mellitus, peptic ulcer, psychosis, osteoporosis, infections. Side effects. Glaucoma, peptic ulceration, osteoporosis, growth retardation. Ocular hypertension, pancreatic disturbance, edema, nausea, vomiting, insomnia, nervousness, nocturia, increased appetite, obesity, euphoria, sodium retention. Dosage. Adult dose vary from 5 mg to 60 mg depends on age and indication. 5. Amoxicillin. Overview. Amoxicillin is a penicillin antibiotic, indicated for the treatment of susceptible bacterial infections. Indications. Endocarditis, oral, ear, nose, and throat infections, Helicobacter pylori eradication, lower respiratory tract infections, rhinosinusitis, acute bacterial infections, skin and skin structures infections. Contraindications. Contraindicated in serious hypersensitivity to amoxicillin or to other beta-lactams, or any component of the formulation, infectious mononucleosis. Mechanism of action. Amoxicillin inhibits bacterial cell wall synthesis by binding to one or more of the penicillin-binding proteins PBPs, which in turn inhibits the final transpeptidation step of peptidoglycan synthesis in bacterial cell walls, thus inhibiting cell wall biosynthesis. Bacteria eventually lyse due to ongoing activity of cell wall autolytic enzymes, autolysins and moraine hydrolases while cell wall assembly is arrested. Side effects. Headache, diarrhea, nausea, vomiting, vulvovaginal infection, agitation, anxiety, behavioral changes, confusion, dizziness, insomnia, reversible hyperactivity, seizure, hypersensitivity angiitis, Clostridioides difficile-associated diarrhea, staining of tooth, eosinophilia, hemolytic anemia. Dosage. Dosage. Adult dose vary from 0.25 to 0.5 grams, 8 hourly PO, IV, IM depending on age and indications. 6. Aspirin. Overview. Aspirin is an NSAID, non-steroidal anti-inflammatory drug. It has anti-inflammatory, analgesic, antipyretic and antithrombotic activity. It interferes with prostaglandin synthesis by irreversibly inhibiting cyclooxygenase. Indications. Fever following coronary bypass surgery, headache, inflammation, ischemic event, unstable angina, myocardial infarction, mild to moderate pain, myocardial infarction prophylaxis, pain and inflammation in rheumatic disease, in other musculoskeletal disorders, prophylaxis of cerebrovascular disease, pyrexia, stable angina pectoris, stroke prophylaxis, and can also be given in adjunctive therapy as an alternative drug of choice in arterial thromboembolism prophylaxis, colorectal carcinoma prophylaxis, juvenile rheumatoid arthritis, neurogenic bladder, osteoarthritis. Contraindication. Aspirin is contraindicated in conditions like GI ulceration, hypoprothrombinemia, hypersensitivity. Side effects. Urticaria, GI bleeding, rhinitis, angioneurotic edema, hepatitis, hepatomegaly, cerebral hemorrhage, airway obstruction, gastric ulceration, gastric erosion, coma, acidosis, hyperthermia, volume depletion, hyperglycemia, renal failure, hyperventilation, cardiovascular collapse, vertigo, tinnitus, hyperkalemia, dizziness, vertigo, nausea, vomiting, tinnitus, epigastric discomfort, dyspepsia, asthma, respiratory alkalosis, bleeding. Dosage. Adult doses up to 900 mg depending on age and indication. 7. Montelukast sodium. Overview. Montelukast (NA) is oral leukotriene receptor antagonist. Blocks part of the inflammatory process associated with an asthma attack and thus helps to reduce swelling or constriction of airways. Used as an add-on therapy in the long-term management of asthma when treatment with inhaled corticosteroids and beta-adrenoceptor stimulants is inadequate. May cause headache and abdominal pain. Indications. Montelukast is primarily indicated in conditions like asthma, prophylaxis of asthma, and can also be given in adjunctive therapy as an alternative drug of choice in allergic rhinitis. Side effects. The severe or irreversible adverse effects of montelukast, which give rise to further complications include anxiousness, angioedema. The symptomatic adverse effects include headache, restlessness, abdominal pain, agitation, increased sweating, edema, allergy anaphylaxis. Dosage. Adult dose vary from 4 mg to 10 mg in 24 hours of time depending on age and indication. 8. Gentamicin. Overview. Gentamicin is an aminoglycoside antibiotic isolated from Micromonospore purpurea. The aminoglycosides are the compound containing characteristic amino sugars joined to a hexose nucleus in glycoside linkage. Gentamicin is effective against both gram-positive and gram-negative bacteria. Indications. Acute diarrhea, bacterial infections, biliary tract infections, endocarditis, food allergy, muscle relaxation, pneumonia in hospital patients, septicemia, ulcerative colitis and Crohn's disease, urinary tract infection, and can also be given in adjunctive therapy as an alternative drug of choice in solid tumor. Contraindication. Gentamicin is contraindicated in conditions like renal diseases, hypersensitivity. Side effects. Encephalopathy, convulsions, hallucinations, nephrotoxicity. Neuromuscular blockage, peripheral neuritis, anemia, dizziness, vertigo, fever, ototoxicity, skin rashes, exfoliative dermatitis, eosinophilia, purpura, angioedema, pyuria, proteinuria, azotemia, cylindruria, allergies, rashes. Dosage. 0.3% otic topical, 1.5 mg per kilogram dose oral, 3 to 5 mg per kilogram IV IM, 4 to 8 mg intrathecal but may vary depending on age and indication. 9. Aceclofenac. Overview. Aceclofenac, an analgesic anti-inflammatory drug, belongs to NSAIDs, non-steroidal anti-inflammatory drugs. The actions, uses and adverse effects similar to diclofenac. Indications. Aceclofenac is primarily indicated in conditions like ankylosing spondylitis, muscle relaxation, rapid onset, short duration osteoarthritis, rheumatoid arthritis. Contraindications. Aceclofenac is contraindicated in conditions like pregnancy, breastfeeding. Side effects. Severe, irreversible side effects include leukocytoclastic vasculitis, lung hemoptysis. Life-threatening side effects include GI bleeding, peptic ulceration, hematotoxicity. Sign and symptoms produced after acute overdosage include hypotension, nausea, vomiting, apnea, coma, seizures, blurred vision, drowsiness, dizziness, headache, renal failure. Others include vertigo, diarrhea, nervousness, photosensitivity, depression, hearing problems, pancreatitis, hepatic damage, nephrotic syndrome. 10. Abana herbal. Overview. Abana helps lower the cholesterol. It improves the contractility of the heart by exerting a positive inotropic action. Producers. Himalaya Herbal Healthcare is focused on producing and developing safe, natural and innovative remedies that help people live better and healthier. Their products are highly reliable, all natural and effective. Uses. Indications. Abana tablets are useful for 1. Hyperlipidemic conditions. 2. Mild to moderate hypertension. 3. As an adjuvant in the therapy of angina with cardiac risk factors. 4. Cardiovascular and cerebrovascular conditions requiring inhibition of platelet aggregation. Each Abana bottle contains 60 tablets. 11. Loperamide HCI. Overview. Loperamide HCI is antidiarrheal agent. Loperamide HCI is acting directly on the intestinal wall to inhibit peristalsis. It acts more rapidly and is longer acting than diphenoxylate and cogyne. Loperamide HCI is also effective to reduce the amount of discharge from ileostomies. Loperamide HCI is administered orally. Indications. Loperamide HCI is primarily indicated in conditions like acute diarrhea, chronic diarrhea in adults, control of agitated states in elderly without confusion, diarrhea, the pain of bowel colic in palliative care. Contraindication. Loperamide HCI is contraindicated in conditions like acute dysentery. Side effects. The signs and symptoms that are produced after the acute overdosage of loperamide HCI include constipation, somnolence, bradypnea, muscular hypertonia, neurological symptoms, EAS. The symptomatic adverse reactions produced by loperamide HCI are more or less tolerable, and if they become severe, they can be treated symptomatically. These include dizziness, drowsiness, fatigue, nausea, vomiting, skin reactions, abdominal cramps, urticaria, dizziness. 12. Furazolidone. Overview. Furazolidone is antibacterial agent, used in the treatment of bacterial diarrhea and gastroenteritis. It may also be useful in treating travelers' diarrhea, typhoid fever, cholera and salmonella infections. Indications. Furazolidone is primarily indicated in conditions like bacillary dysentery, cholera, diarrhea caused by E. coli, diarrhea caused by Salmonella species, diarrhea caused by Shigella species, giardiasis, intestinal infection caused by Giardia lamblia, traveler's diarrhea, typhoid. Contraindication. Furazolidone is contraindicated in conditions like G6PD deficiency. Side effects. The severe or irreversible adverse effects of furazolidone, which give rise to further complications, include hepatotoxicity, agranulocytosis, hepatotoxicity, hemolytic anemia, acute pulmonary reactions. The symptomatic adverse reactions produced by furazolidone are more or less tolerable, and if they become severe, they can be treated symptomatically. These include dizziness, headache, drowsiness, nausea, vomiting, fever, skin rashes, urticaria, redness, malaise, hypotension, arthralgia, angioedema, darkening of urine, skin rashes, dizziness. 13. ATENOLOL. Introduction. ATENOLOL is a competitive beta-1 selective adrenergic antagonist, similar to metoprolol. Beta-adrenergic antagonists counter the effect of sympathomimetics neurotransmitters i.e. catecholamines by competing for receptor site. Similar to metoprolol, it in low doses selectively blocks sympathetic stimulation mediated by beta-adrenergic receptors in the heart and vascular smooth muscles. It lowers the blood pressure in hypertension and slows the heart rate. Indications. Uses. ATENOLOL is primarily indicated in conditions like angina, angina pectoris, cardiac arrhythmia, hypertension, myocardial infarction, migraine prophylaxis, early intervention within 12 hours of myocardial infarction. Contra-indications. ATENOLOL is contraindicated in conditions like asthma, depression, heart failure, cardiogenic shock, bronchitis, second or third degree AV block. Side effects. Hypotension, bronchospasm, impotence, AV block, hyperglycemia, sinus bradycardia, oculomucocutaneous syndrome, heart failure, convulsions, coma, dizziness, fatigue, diarrhea, dyspnea, constipation, insomnia, depression, blood dyscrasias. 14. Propofol. Introduction. Propofol is extremely important intravenous anesthetic. Propofol is chemically unrelated to other intravenous anesthetics. Propofol is used to induce anesthesia that can be maintained by continuous infusion or with inhalation anesthetics. It produces anesthesia at the rate similar to intravenous barbiturates. Recovery is more rapid and is associated with minimal postoperative confusion. Unlike many other general anesthetics, it possesses an antiemetic action. Uses. Indications. Propofol is primarily indicated in conditions like anesthesia, induction of anesthesia, insomnia, maintenance of anesthesia, sedation for surgical and diagnostic procedures, sedation in intensive care. Contraindications. Propofol is contraindicated in conditions like disorders of fat metabolism. Side effects. Severe or irreversible side effects include CNS depression, transient bradycardia. One of life-threatening side effects is cardiopulmonary depression. Symptomatic adverse effects include thrombophlebitis. Our messages for our pharmacists. Message 1. Respected pharmacists, for your job, kindly send us your desired job specifications and your own following details, so that we may know what kind, which area, which experience and which nature of job you are looking for. Kindly share. 1. Your good name. 2. Current city. 3. Name, area of your residence for pick and drop facility. 4. Permanent district and city. 5. Which city you need job. 6. Which field or which kind of experience you have. 7. Which field you need job, at pharmaceutical industry. At retail pharmacy or distribution setup, with category A. At sales and marketing. 8. If you are fresh graduate, with no experience, kindly share. 9. If you are still student, kindly share your university name and the year professor. 10. If you are willing to do internship, kindly let us know. Message 2. Pakistan Pharmacist Association PPA Cabinet 2023-2025 welcomes to all of our pharmacists. 1. Pharmacy councils of Pakistan are trying their level best to serve pharmacists in all provinces of Pakistan. Kindly let us know if you are experiencing any kind of difficulty in Pharmacy Council. 2. Justice should prevail everywhere. If any of our pharmacist is victim of injustice at any department or institution, come to us at PPA House, we will get you your rights inshallah. Dr. Majid Body Pharmacist. Pharm. D. M. Phil LLB. Vice President. Pakistan Pharmacists Association PPA Punjab. Contact 0321404236. Thank you.